Welcome to the Modern Wellness Podcast. I'm your host, Dr. Mary Pardee. This podcast, along with my private practice in LA and my newsletter, all are aimed to providing you evidence-based information around preventative medicine, longevity, and health in general. Join me in dispelling health myths as well as cutting through the noise that is social media. I hope that whether you want to optimize your performance or just in general get healthier, the Modern Wellness Podcast will help you do that. Dr. Ingrid Murra is a Harvard-trained orthodontist and founder of TwoFront, a venture-backed teeth longevity platform connecting top aligner specialist orthodontists with dentists around the country to give patients perfect teeth fit before damage occurs. She's on a mission to transform dentistry from insurance-driven reactive care into prevention-focused oral health by bringing a new era of teeth longevity to healthcare. All right, welcome. I'm excited to have you here today.
Me too. Long time coming.
I know. It's really fun to actually be able to work with your friends. And
I feel very lucky.
I respect your work so much, and so it's really fun to just be able to do this on a podcast and incorporate our play into our work.
I'm very excited for this. I feel like we kind of talk about work, in between things, and this is kind of like our first, all right, let's get into it.
Yeah, absolutely. Absolutely. All right, so I want to start by just talking about why you think that most dental work is actually preventable.
So teeth are meant to last 100 years plus. We should be keeping our natural teeth for life. Enamel is the strongest component in our body. It's the strongest material in our body. And the problem is that we've just never been taught how to keep it. Enamel wears. It wears irreversibly. So when we get all of our teeth in our teenage years, they come in perfectly. All of our teeth are these perfect little creatures. And then we damage them in different ways. We don't brush them well. We don't floss them well. That's the mantra we have. But there's another half to that. And the other half is that we're wearing away our teeth. And a lot of the reason we wear away our teeth irreversibly is because we don't have this thing called perfect teeth fit. In orthodontics, we call this occlusion, how our teeth fit together. But that is causing us to chip our teeth, crack our teeth, wear our teeth. And that's what causes long-term comprehensive dental work over our lifetime. So we'll get a couple cavities in our 20s and our 30s, but then it really picks up in your 40s, 50s, 60s because you've had a couple decades of just chronic teeth wear. The fourth component to that is what we eat all day, every day, what we drink, all the acid that's bathing our teeth. We don't talk about it as a culture, that it's irreversibly wearing away our teeth, the acid in these wellness drinks and all the things that you and I love, and we're just not talking about it or doing anything about it.
Ugh, okay. This is my kryptonite because I'm a Coke Zero, Diet Sprite, lemon water. I don't like plain water. It's really hard for me to want and desire plain water. I use straws. Is that going to help at all, or is that
it does? Okay. Yeah, because you're not bathing your teeth in that acid.
What else can we do though besides straws? Is there anything else that you can still drink the drink but not damage the teeth?
Yes, and it's actually super simple. We just have to be aware of it. We take care of our heart health, our gut health, our brain health for our teeth health. It's every time we eat something, all we have to do, when you can actually eat whatever you want. You can drink all the acidic drinks, the orange juices, the green juices, the coffee. Like, first of all, you have to be aware of what's acidic and realize that acidity is bathing your teeth. And if you're just drinking a sip of coffee and going about your day, that is acid bathing your teeth. That is literally wearing away this permanent enamel. And it doesn't happen overnight, but over every single day, it happens. And that is what causes teeth aging. So it's a really simple trick. All you have to do is swish plain water after whatever you eat or drink that's acidic. And now your teeth they're not bathed in acid.
I mean, that's so simple. It's also like we would never put clothes into a bucket of bleach and leave it there for 7 days, right?
Exactly.
You take it out, you rinse it off, and you're done. But we don't do the same thing with our teeth.
We don't do it with our teeth. And the problem is it's not culturally relevant. People fear the dentist. Taking care of your teeth isn't something that's talked about the way that taking care of your gut health, your brain health is.
Do you have to, because there's a lot of people that have veneers, and I know we're going to go into that in greater depth, but from the lens of acidity, do people with veneers have to worry about acidity as well?
No,
Not as
because they've already stripped away their enamel.
so the material that's there doesn't get damaged by acidic foods.
It can. The porcelain itself the color can change,
Okay.
but it's not going to wear
It's
from the acid.
Yeah. Okay. That makes sense.
Yeah.
And then you mentioned something else when you were talking, which is this perfect teeth fit. Can you go into that a little bit more?
Yes. So orthodontics has historically been this thing that you do as a kid. You get braces, you go to your orthodontist, and then your teeth move, right? And then you're in your 20s and your 30s, your teeth have shifted, and people think about it as this cosmetic thing.
Mm-hmm.
But the reality is, that no one talks about, is that having perfect teeth fit is actually a crucial part to keeping your teeth for life. Because if you don't have perfect teeth fit, you're going to continue getting damage to your teeth and wearing away your teeth, especially if your bite is off. If your bite is off at all, that means that when you're putting 250 pounds of forces a day on your teeth, you are putting them in an incorrect space, in an incorrect place, and you're going to put forces that are going to lead you to get dental work over your lifetime.
Yeah, it's mechanical. That makes
Yeah.
sense. It's like building a bridge that has a few things crosses in the wrong places. It's not going to go well if you're putting force there.
Exactly, but we don't talk about that as a culture.
Yeah.
And that's what we're on such a mission to do, is help people recognize that if you have perfect teeth fit, you're much more likely to keep your teeth for life.
And you're saying teeth should last 100 years, like basically a whole human's lifetime.
Mhm.
How common is that for people?
It's not common because we as a society don't have the tools to know how to keep our teeth for life. The crazy thing is dentists know. Dentists are generally keeping their teeth because we know. But the problem is that dentists operate in this insurance reimbursement based system that rewards reactive care. They reward seeing disease and treating it, not actually helping our patients prevent it.
Okay. I want to go through all those things, how you need to keep your teeth till 100 during this podcast. I think we're slowly going through them, but that's kind of in the back of my head. Okay, the shift from insurance-based to reactive dentistry in terms of teeth longevity. Can you talk a little bit about that?
Yeah. So over dentistry is like historically 20 years behind medicine, right? And medicine right now, we're finally getting to the place where we're recognizing that we need to be in this prevention focused era, right? This
Yeah.
is the whole point of our entire community,
Mhm.
everything we're all doing. Dentistry is 20 years behind.
Mm.
So we are still, as a society, living, even top dentists, right? Living in a world where insurance is just reimbursing for finding teeth disease and gum disease. And the bigger the disease, the bigger the reimbursement. The more dentists get paid, the more disease they find. And the reality is, we're not incentivized. We're not incentivizing dentists to actually prevent dental work in the first place. So, how do you prevent dental work in the first place? We tell our patients brush and floss, right? It's not enough. It's not enough. Because if you don't have perfect teeth fit, there's nothing you can do about it. If you have crowding, it doesn't matter how much you brush and floss, your bristles cannot get between crowded teeth. So what's going to happen is that you're not only going to be susceptible to teeth disease, you're also going to be susceptible to gum disease. 60% of US adults have invisible gum disease and they don't even know it.
Mhm.
And that gum disease, that negative anaerobic bacteria from your mouth, is seeping into your bloodstream. And then that leads to systemic disease.
Yeah, and this is really, really common too. I feel like gum disease is something that we don't talk about a lot in medicine. I know you guys talk about it a lot more in dentistry, but it's not an uncommon thing. Do you know how many people end up getting diagnosed with gum disease?
Well, the problem is a lot of people aren't going into the dentist to get diagnosed in the first place. But over 60% of Americans, over 60% of adult Americans over 30 have gum disease.
Huge. And what are the symptoms that people would actually feel if they had gum disease?
That's the problem, is it's invisible.
Oh,
So only your dentist can tell, and they can tell by probing and by measuring the bacteria in your mouth and seeing the proportion of negative anaerobic bacteria to the rest of your healthy bacteria. But that's the problem, is we don't realize we have gum disease. You can tell once it becomes chronic. You can tell once it's like your gums are really inflamed
Right.
and maybe you have a little bit of pain. But that initial gum disease that is still affecting you, it's still causing disease and bacteria to get into your bloodstream. It's invisible.
So by the time you're experiencing symptoms of inflammation, maybe bleeding gums, then you're already well into the disease, it
You're
sounds
already
like.
well into it. Exactly. If your gums are bleeding, go to the dentist immediately because that means you have a deeper level of gum disease.
Do dentists actually talk about this with patients? Like, hey, you have early stage gum disease?
Yes, but here's the problem. The problem is that people don't trust their dentist.
Yeah.
And not only that, dentists are scared of patients. Dentists are so scared of their image,
Right.
of looking bad. And so a lot of dentists, they don't know how to talk about it to their patients. You know this being a doctor,
Yeah.
how hard it is to deliver bad news. Dentists are sick of delivering bad news, and they're not that well trained. I know this going through my own fertility journey right now. It is really hard to deliver bad news. It's
Yeah.
really hard to be empathetic, to do it well, to do it in a way that patients actually listen.
Mhm.
Dentists do that all day, every day,
Yeah.
and they almost become numb to it
Yeah.
because more than half their patients have that gum disease. And so they're not that well equipped to really talk to you as a human and be like, hey, this is why this is really concerning and you've got to do something about it.
Yeah. Yeah. So I just went to the dentist this past week, and I literally planned it because I knew we were gonna have this podcast, and I'm like, "Oh, this will give me more to talk about." And I clench my teeth and I grind a little bit at night, but I have clear liners because I
Mhm.
had, I'm like the one person that I've worn my clear liners since I had braces. I've gotten new ones, obviously. But I still wear them every night. And my previous dentist said that'll be good for the grinding and the clenching. Just keep wearing your clear liners. New dentist is like, no, you need a mouth guard.
Mm.
You need a mouth guard because you need more cushion because you're clenching and you don't want to chip the teeth or wear them down. And then I have a little bit of gum recession too because of the clenching.
Mm. This
But
is
like
a
you said, I left being like, I have to ask Ingrid about this because I don't know what's true anymore because you go to the dentist and sometimes they tell you that you need all of this work done. And I'm like, is that true? Because it's not my field.
Yeah, this is a really controversial thing in our industry. So here's the problem. If you're clenching and grinding, yes, you're going to get gum disease and you're much more likely to wear away your teeth and actually age your teeth.
Hmm.
So you've got to do something about it. You've got to protect your teeth with some sort of layer. So it's amazing that you're wearing clear aligners. Here's the controversy. The reason that there's so much dissonance between dentists on how to actually prevent your teeth from getting worse when you're grinding is that dentists don't learn how teeth fit together or what we call orthodontics in dental school.
Mm,
So when
that's not their specialty.
that's not their specialty.
Yeah.
So when they prescribe putting something between your teeth, they don't know how that's going to affect the movement of your teeth. Because teeth move every day, all day. We have these things called periodontal ligaments that hold our teeth in place. And that's what helps us like chew really hard and not actually break our teeth because our teeth are all in our bone. And so it's kind of like this spring that helps our teeth like really stay in there. So when you put something in between your teeth, you're actually moving your teeth. So it's really important that your dentist knows what should be put between your teeth so that you don't move your teeth in the wrong direction.
Mm,
So in this case, you have clear liners. They fit your teeth perfectly. That's great. The problem with clear liners, it's great because it's not going to move your teeth in a different position. The problem is that most clear liners are really thin. And so you're going to wear away your clear liners eventually. But some dentists swing the opposite way. Like it sounds like your dentist may be swinging, which is just like we need a lot more cushion. The problem with a lot more cushion is that it puts your teeth in a different position and it can actually change the way your teeth fit together. It can change your bite, and that can cause all sorts of issues, headaches, right? Like jaw pain. And that's irreversible until you get orthodontics. So one of
mm,
our good friends experienced that. He was having a lot of jaw pain and he ordered like a retainer online, like a mouth guard online. And he called me one day and he's like, I can't bite on my back teeth. And that's exactly what
because the
happens
retainer.
because of the retainer. So, whatever the thing is, over 50% of adults are grinding right now, and everyone needs to be protecting their teeth. The solution is you need a thicker clear liner. The one that I recommend is called a Bivera retainer. And depending on how much you grind, you're going to have to replace it. And it is what
Yeah.
it is. And you just replace it every couple years until
Okay.
you grind through it.
I feel like that's the one you told me to get, and I might have gotten that one originally. It looks exactly like a clear liner.
Just thicker.
Okay. I'll have to check on that because he scanned my teeth in the office to get me that night guard.
Yeah.
Could that have been it, or we don't
Yeah.
know?
Yeah.
Okay.
Definitely. You're going to scan your teeth no matter what. The question is, what are you fabricating over
Yeah.
that scan?
Yeah.
And some people are fabricating something that's too thick and it's going to move your teeth. And there's all sorts of crazy mouth guards out there. And again, it's because dentists don't know. They don't know how it's going to affect the position of your teeth in the long term.
Yeah.
And so that's where orthodontics really needs to be merged with dentistry so that patients can have holistic dental care and make sure that they're not damaging their teeth because of this retainer.
Okay, so for somebody else that's listening like me who's got the teeth grinding and they don't want to move their teeth in the wrong direction, who should they go to see to figure this out for them?
So the Vivera retainer is an Invisalign product.
Mhm.
So as long as you go to a dentist, you can look at the Invisalign website. As long as you go to a dentist near you who offers Invisalign, they're able to order the Vivera retainer and they'll just scan your teeth and order that Vivera retainer.
Okay, great.
Yeah.
Super helpful. I will be looking and getting back to you via text message about my oral hygiene. um, okay, teeth aging, how and why. I think we covered a lot of it. I don't know if there's anything else that you want to put in there, but I also want to go into why dental work specifically ages your teeth.
Yeah. So think of your teeth almost like a bridge with like a lot of different components, right? Like all the different, now I'm going to mess it up. What are all the different sticks in the, the different parts of the bridge?
Yeah, I don't know.
Whatever.
Not
they're
a bridge girl.
I'm not a bridge girl. But they're all structural, right? And if you have a bridge, and let's say that bridge, there's all cavities are is like it's eating away a part of the bridge, right? And then you're like shoving that part of the bridge with like some sort of material, right? But it's not the initial material. It's not going to keep the structural integrity of your teeth. So every time you take away a part of your tooth, whether it's through a cavity or a crown, what's happening is you're losing structural integrity. And that enamel is a crystalline structure and it works kind of in one holistic way. If you think of each of your teeth as a living organism, each of your teeth is a living organism. You literally have 32 living organisms in your mouth. That enamel is there to protect that living organism. Every time a piece of that enamel goes away, your teeth are becoming less structurally sound.
Yeah.
And it's irreversible, right? Like it's not like you're cutting your hair and it's going to grow back. If you're losing enamel and you're putting something in there, that material isn't going to last a lifetime. You're going to have to replace it. And each time your dentist is going to have to drill further down and replace it even more. So every time you get a cavity, you're really aging your tooth.
But sometimes if you get a cavity, you have to do this, right?
You have to do it.
So it's not like you can, but obviously we want to prevent the cavities from happening so you don't have to do it.
Exactly.
Yeah.
Prevention, if you can prevent them if you get it, there's nothing you can do about it, right? As long as you have, and that's another question is like, do you actually have to take care of that cavity? Because cavities are they're layers, right? Like I've had some cavities they're called E1 cavities. They're one layer into the enamel. I've preserved them kind of there for a long time, like a decade. You can do that by just brushing really well with fluoride or hydroxyapatite toothpaste, and you'll never have to drill those cavities. Once they get into the dentin, which is that inner layer of your tooth, that's when the bacteria is likely to go to the pulp. Once it's into the dentin, that's a cavity. That's like you've got to take care of it.
Okay, so the earlier stage ones that you're talking about, can you ever reverse those? Or once you have a cavity, you got the cavity, you can't reverse it?
Yeah, totally.
Yeah.
So, okay, if you think of your tooth as layers, or the outer layer is enamel, the inner layer is dentin. Enamel is a crystal. If you get a cavity in your enamel, it's reversible. If you get a cavity in your dentin, it's irreversible. Dentin is tubes. They're literally tubes that lead to the pulp, and the pulp is the lifeblood of your tooth. That's the nerves, it's the blood vessels. So once it's into the dentin, that's bacteria that's going straight to your pulp. So once it's there, you've got to take care of it. So dentists consider cavities E1, E2, and then D1 and D2 lesions. Once it's D1 and D2, you've got to take care of it. But if you've got a cavity in the enamel layer, the E1 or the E2, you can reverse it and you can prevent it from getting worse.
So interesting. Tell me if I'm wrong, but it sounds like orthodontists should be a part of healthcare prevention, not the person you go to if you need to straighten your teeth. Do you know what I mean? It feels like they need to be looped in with the dentist's office or someone that you see, I'm trying to think of the equivalent in medicine. Your gastroenterologist when you turn 45 to get a colonoscopy. We need these guys somewhere in the line so you're not skipping them.
That's exactly right, and that's our whole mission behind what we're doing at my company, Two Front. It's and the thing is dentists know this.
Mhm.
They know this because they see it every single day. Like, let's say a dentist fills a cavity, right? But a patient has, like, a deep bite. They know that the patient's much more likely to break that over and over and over again
Yeah.
over their lifetime. But culturally, patients don't realize that having a perfect teeth fit by an orthodontist is going to help you keep your teeth for life. And the problem is that dentists don't know how to do it. They're living in this insurance reimbursement-based system, so they're not incentivized to say, "Hey, let me, help you with orthodontics and help you prevent this from getting worse."
Yeah. Okay, let's say you're somebody who has crowded teeth. It sounds like you have to be much more diligent about actually cleaning them. That's the big piece that becomes a lot harder. Can you actually brush them correctly? Can you floss them correctly? Can you get through the nooks and crannies to prevent all these things? Assuming that you can you prevent a lot of these things happening, or are you really just an advocate for perfect teeth fit?
I'm an advocate for perfect teeth fit
Yeah.
because listen, if you have a tiny bit of crowding, right? If you have like a little bit of
Yeah.
overlap, 1 millimeter, you're fine. If you have more than that, it doesn't matter how much you brush or floss. The problem is we have over 5,000 species of bacteria in our mouth. A lot of them are good, but some of them aren't, like negative anaerobic bacteria. If you are not able to clean between your teeth, you're basically risking that bacteria getting into your bloodstream, right? And then getting into we found this negative anaerobic bacteria in Alzheimer's plaques, in heart plaques, in plaques all over our body. It sits there, right? And
Mhm.
so I would recommend always taking preventative care and putting your teeth into that perfect position.
Mhm. Yeah, it definitely makes the odds of everything going better a lot higher too, right?
Yeah, exactly.
Okay, I want to go through preventing teeth aging from everything that we can think about. So, just in terms of somebody has obviously perfect teeth fit is going to be one of your things. But what are all the other things that people need to do on a daily basis, monthly basis? How often to go to the dentist? What's kind of the gamut to prevent teeth from aging poorly?
So there's 4 key components. One is brushing well, the second is flossing well, the third is
I'm
having
going to pause you.
yeah,
How many times per day?
brushing and flossing twice a day.
Twice a day.
Twice a day.
Flossing twice a day too.
Yes.
Oh, I have to up my flossing. I do it once a day.
Yeah,
But
yeah,
then I also always walk around with, like, a toothpick in my mouth because
yeah.
I hate things getting in between my teeth, but,
Mm. You
um
might have some spaces between your teeth that are causing things to get between your teeth,
mm,
and that's kind of that symptom of not having perfect teeth fit.
okay.
That's making it harder for you to actually clean your teeth because you don't have that perfect contact that's preventing things from getting in between your teeth.
Yes. Okay. Flossing twice a day, brushing
Brushing,
twice a day.
perfect teeth fit,
Mhm.
and taking care of and having good oral hygiene habits. So that is primarily like the rinsing in
Mhm.
between all
Acidics.
acidic beverages. Just being conscious of how many acidic things we eat and drink a day. Like I know for me, just like you were saying, it's coffee, it's these element juices or like the powders in my waters that are acidic. It's my green juices, it's my lemon water. Like there is a lot of acidic things that we're putting into our mouth every day that are bathing our teeth in acid. After all of those, you just have to swish with water. And as long as you're doing that, you're preventing that acid from corroding your teeth.
Yeah. So if you're, like, sipping on a coffee over the course of an hour, are you suggesting sip on the coffee, sip on the water?
So it's less that strict. Like, you could be a little bit crazy. Like
Yeah.
honestly, I'm probably that crazy because I want my teeth to last my lifetime. I want my natural teeth for life.
Yeah.
Um, but if you're drinking a cup of coffee, I would just swish like afterwards.
Yeah.
Like if you're drinking a cup of coffee over an hour, just swish right afterwards.
Okay. Do you have to worry about brushing too soon after coffee? I've heard that.
Yes, because your teeth are being bathed in acid. And so it's much better to bathe your teeth in water after the acid, rinse all the acid off of your teeth. If you have acid on your teeth and then you're taking like, it's all mechanics, right?
Yeah.
And then you're taking bristles and you're basically rubbing that acid
Yeah.
into your teeth, you're just making it worse.
Yep. Okay. Okay. Heard. Anything else that we missed?
Those are the four. It's brushing. The thing is, most people don't do it, and they don't do it. If they're doing it, they're not doing it well.
Okay.
But it's all about our discipline, right? Like we're so disciplined about our health habits. We for some reason we don't take into consideration.
Yeah.
Most people don't take into consideration the discipline around our health habits, around our oral health as much. But it's really good at brushing. It's really good flossing, using the right materials, doing it consistently, doing it well, having that perfect teeth fit, and having those great oral health habits.
Yeah. So I have a questionnaire with all my new patients, and I'm shocked by how many people, and like no shame, no guilt or anything, but I think it's very common for people to only brush their teeth once a day.
Yeah.
And that's surprising. I mean, I just grew up with like that regimented thing, but I don't think it's uncommon for that piece to not be there.
It's very common. And the problem is that we don't take into consideration how important our teeth are for our happiness and our longevity. Also, people our age, they don't realize the average American loses over 10 teeth by the time they're 50.
Whoa.
And the average American spends over $50,000 in dental work over their lifetime.
Wow.
And we don't realize it until it's too late, right? Once you get to that point, your dentist is like, here's what we can do. But there's things that we can do ahead of that, and we just haven't brought it into culture.
Yeah. Our mutual friend just had tooth work done, and I remember he was going through it, and he just kept saying to me, he's like, Mary, brush your teeth. Mary, take care of your teeth. Because he didn't realize until he was there that, oh, he wished he had taken better care of his teeth beforehand. I mean, that's with anything, right? We see it all the time in healthcare where we take everything for granted until it's being negotiated with, and then we're like, oh gosh, when I get over this, I'm really gonna take care of my teeth. But if we do that
Which is
before.
why it's so important to bring it into culture. We've got to make it cool to take care of your teeth.
What about sugar? Eating sugar, any effect on teeth health?
Oh yeah, for sure. It's that process of your bacteria feeds on the sugar.
Yep.
You've got this bacteria that's feeding on the sugar in your mouth. So it's a myth that sugar itself causes cavities. It's the fact that the bacteria is feeding on the sugar, and the bacteria release acid, and the acid is what causes the cavities.
Okay, so we're back to the acid story.
Mm-hmm.
And I was reading that because people are going to eat sugar still. I love sugar, but reducing the frequency during the day that we eat it versus maybe the total amount. I mean, of course, we care about the total amount of sugar we're eating, but that way you're saying if you only eat it once or twice a day, and then you're washing with water in between, less exposures during the day, less time for that acid to be wearing away.
That's exactly right. It's all, if you just think, how do I keep my teeth healthy? How do I keep my teeth for life? How do I reduce the acid exposure to my teeth?
Okay. Let's go into veneers. Veneers are super common, especially we're in Los Angeles. People with, totally healthy teeth will get veneers just for a cosmetic effect. I want to know your thoughts about that. Is there any downside to getting veneers from a health perspective?
Look, I'm gonna start off this conversation by saying I am an orthodontist, so I am biased, right? Like if I'm not a cosmetic dentist, I think veneers are extremely overprescribed in our society. It feels easy. It feels quick. People think of it like cosmetic surgery, like they're getting Botox or like they're getting some sort of like a nose job or something. But what people don't realize is that when you're committing to veneers, there's a lot of things that can go wrong, and there's a lot of downside effects to it. So, for example, let's say a lot of people get veneers because their teeth aren't straight. The problem with that is that veneers it's a structural thing, right? So let's say your teeth aren't straight and you're putting veneers in your teeth. The problem is that the roots, just like a bridge, the roots are all still going in different directions. So if you're putting veneers on unstraight teeth, what's happening is you're increasing the failure rate of those veneers. In society, 1 in 3 veneers fail.
Wow.
1 in 3 veneers. And that can be anything from it cracks, it chips, the color changes. And what most people don't realize is that you're committing to a lifetime of replacing those teeth. Veneers are only meant to last 10 to 15 years. And if you get veneers over teeth that aren't straight, those veneers are going to pop off much sooner because they don't have a good structural integrity. It's like putting paint on a bridge that's collapsing.
Okay, and the actual process of putting the veneer on, they're also shaving down the tooth, right? So are they getting rid of all the enamel?
So this depends. This
Okay.
depends on the cosmetic dentist. It depends on their technique. But yes, they're shaving away parts of your enamel at a minimum. Sometimes they go into dentin. So you're taking away perfectly healthy tooth structure. So it goes back to, why is the patient getting veneers in the first place? They want a more beautiful smile, right?
Hmm.
What most people don't realize is that you can actually get that beautiful smile with clear aligners. As long as you're going to a specialist who specializes in moving teeth with clear aligners, you can get those beautiful straight teeth, what we call, dentists call the golden proportion, the golden ratio, where we can get that beautiful harmonious smile. One of the biggest requests people have in their 30s is widening their smile.
Right.
If you go to a clear aligner specialist, you can get that. So you can actually get it for so much cheaper, so much more stable, natural, not not affecting your enamel, and then you can whiten your teeth. There's nothing wrong with that. And it's such a healthier way to get a beautiful smile.
Yeah, interesting. And if somebody is just doing this from an aesthetic standpoint, so that's the only reason that they're going in for veneers and they're shaving down that enamel, is there an increased risk for infection because some of that is gone in terms of the fit? I have no idea. So the answer could be
Always,
no, but
always. Yeah. Let's say there's a void between the veneer itself
right. That's what
and
I'm,
your tooth. That is a void where you can get cavities in there.
yeah.
It's a failure risk. So you are increasing the risk of unhealthy things happening.
Yeah. Fascinating.
Yeah, and we have made it seem easy, we've made it feel sexy, but there's so many downward consequences of it. So if you were to ask me, should I get veneers or not, right? Like, that is a question that I get all the time. People ask me, should I just go ahead and get veneers? In my people in their 30s and their 40s. Why? Your teeth are starting to move a little bit. Your teeth are starting to look a little bit yellow.
Yeah.
And people they just think veneers. They don't
Yeah.
realize there's anything else they can do about that.
Right.
The way that I would say, should you get veneers or not, is, first of all, are your teeth, do they fit? It's in dentistry, it's what we call the Bolton discrepancy. A Bolton discrepancy is there a difference in size between your upper and your lower teeth? If your upper teeth are much smaller, for example, then you might need a veneer cosmetically to make them the same width and give you that perfect, beautiful smile. Let's say patients have tetracycline staining.
Mhm.
That's something irreversible, and whitening can't do anything about that. Or let's say that your teeth have worn a lot.
Mhm.
If your teeth have worn a lot, there's nothing really you can do about that, because you need to build back up that look of enamel, and the only way to do that is with porcelain or with some sort of cosmetic material. So if your teeth still look beautiful, they're just not the right color or they're not in the right position, I would 100% go to a clear aligner specialist who specializes in Invisalign, and whiten your teeth afterwards.
Yeah. And do you recommend over the counter, like Crest white strips, on just a more regular basis, or go and get them professionally done at a dentist's office?
I would do the Crest white strip
More
route.
gentle.
Yeah, gentle, daily, weekly. You can do it for 2 weeks at a time every 3 months. That's
Okay.
what a lot of people do. There's no issue with that.
Yep.
You'll feel a little bit of sensitivity, and if you do, you can always lower the hydrogen peroxide percentage. If you go on Amazon, you can choose 15% hydrogen peroxide or 20%, and you're fine with that. That doesn't damage your teeth at all.
Okay. Amazing. What else did we not cover? Maybe like any of the big myths that come up in the teeth dentistry world that you see on social media that make you crazy. Those are my favorite to bust.
Yeah, so this is kind of this is what the clear aligner industry is, what transitioned me from practicing as an orthodontist in New York City to
Mhm.
running Two Front.
Mhm.
This is the biggest myth in our society in dentistry, that clear aligners are, a commodity and you can just get them and you're going to get great results. In order to get great results with clear aligners, you have to recognize that clear aligners are a tool. They're a very tech-enabled tool, but just like a football, right? A football that is thrown by Tom Brady versus a 2-year-old, or a knife that's used by a professional chef versus someone who's never cooked before. Clear aligners are a tool. And the more you use that tool, the better you are at that tool. Like Tom Brady versus a 2-year-old, right?
Yep.
Clear aligners, the average general dentist does 7 clear aligner cases a year. I say clear aligners because Invisalign's the biggest one, but there's a lot more clear aligner companies out there. Spark, Angel Align, you'll see a lot of them, right? Average dentist does 7 Invisalign cases a year. That is nowhere near enough to be able to give you great predictable results. Okay. And even orthodontists, right? There's 10,000 orthodontists in the country. Clear aligners have only been around for 25 years. So even though there's 10,000 orthodontists in the country, over 90% of them specialize in braces. So going to an orthodontist to get Invisalign does not guarantee you that you're going to get a perfect teeth fit and a perfect, beautiful smile. So the only way to actually know that you're going to get a great result with clear aligners is, number one, using Invisalign. It is the best tool out there. It is the best. It's like using, I'm going to butcher this, but a beautiful Japanese perfect knife versus a knife that isn't that great, right? You need that chef to use the best tool. In the clear aligner world, that is Invisalign. In terms of who you go to, this is much harder. You want to go to an orthodontist because they have 3 years of specializing in what's called biomechanics. Biomechanics is how we get that beautiful, perfect teeth fit, right? First of all, you want to go to an orthodontist because they have 3 extra years of training. Then you want to go to someone who specializes in Invisalign. That is a very hard thing to find. Even if you go to the Invisalign doctor locator, they have statuses. So they'll have the diamond status, the platinum. So you may think, oh, if I go to a diamond status orthodontist, I found the right person. Here's what you don't know. Just because they've done diamond means they do 350 cases a year. Just because they do 350 cases a year at this one location, you don't know if that's one doctor working there or 10 doctors.
Yeah.
You don't know.
Or if you're getting the new doctor who just walked in and did
Bingo.
did one case of the 350.
Bingo. Exactly. And not only that, the way that we measure this, the way we measure quality on the back end is what we call refinements. Refinements is how many sets of aligners you are going to take to get your patient that perfect teeth fit. So if you go to someone who does 7 cases a year, they might go through 7 to 10 refinements or orders of aligners. That's maddening because someone who's a specialist could do that in 1 or 2 refinements, and you're going to get those better results much faster and much more predictably. So that is not public knowledge.
Yeah.
Invisalign gatekeeps refinements on the back end.
Yeah.
So what we do in my company, Two Front, is we take these top clear aligner specialists. We have a platform where we connect them to general dental practices all over the country so that these specialists can actually guarantee that perfect teeth fit. Our specialists have done at least 1,000 Invisalign cases with 2 refinements or less. So you know if you are getting Invisalign at a Two Front practice, you are going to get the most beautiful smile, the most perfect teeth fit for your health in the shortest amount of time.
That's incredible. And so you guys have created such a cool model because I'm guessing too, if somebody is listening right now and they have a dentist that they love who maybe is offering clear aligners, but not through Two Front, could they ask them, hey, would you guys be willing to bring in Two Front to your office so that I know I'm going to get the orthodontist who has all of these cases under their belt with less refinements? Is that part of?
Yes.
Yeah. And it's for me, it would be a no-brainer for the dentist as well, because your patients are going to get way better results, less complaints, right? And just easier load on you. You're taking a lot of that work off of their plate. So
That's exactly right.
Yeah, it's brilliant.
We've actually made it much more profitable and much more efficient for them.
Yeah.
Because of course, the question for dentists, understandably, we're living in capitalism, is, well, I don't want to refer out this patient because, I'm going to lose that money. So the system that we built is one where dentists and orthodontists actually collaborate on the platform, and they're both doing treatment a lot more efficiently.
Yep.
So we have dentists that it's a whole source of income for them through Two Front because they recognize the effects of not having perfect teeth fit. So dentists who are using Two Front are typically referring most of their patients because 80 to 90% of adults don't have perfect teeth fit. So they actually prescribe it, like you were saying earlier. They prescribe this orthodontic evaluation as part of their exam. So you're getting your x-rays, you're getting your cleaning, and you're getting an orthodontic evaluation at every exam because teeth move every 6 months. And so when you do that, and dentists are actually incorporating orthodontics as a way of practicing preventative dentistry, they're actually making a lot of money.
Yeah. Super interesting. Okay, so somebody's dentist does not collaborate right now with Two Front. They feel like they need to go get seen to see if they need clear liners. How can they check to see where are the Two Front approved or collaborating dentist office?
They can go to our website,
Okay.
my2front.com. It's spelled out like my two front teeth.
Mhm.
And they can basically type in their zip code and find the closest provider to them.
Incredible. Anything else that we missed today? This was super informative. I'm gonna go get a water to rinse my teeth after my coffee right now.
I think that's it. I think I'll end with I got into dentistry when I was 8 years old because I was insecure about my teeth and I realized the power of orthodontics. But what I'm so passionate about now is helping people realize the power that their teeth health has on their health span
Yeah.
and their happiness. We're going to live so much longer now, right? We all know that. We are so privileged. Want to live a longer, happier life. If you if you're like the average American and you're losing 10 teeth before you're 50, you are going to have a lesser quality of life. So my passion now is helping people recognize how important your teeth health is to your happiness and your longevity.
So important. I mean, if you're listening to this podcast, that's what you care about because that's the main theme here is prevention, prevention, prevention. Whenever I talk, I'm always saying longevity is the buzzword, but it's about prevention. It's about how do we do what we can do in a reasonable manner that doesn't drive us crazy. But taking a sip of water after seems such low-hanging fruit and looking up where the provider you should go to see to make sure you get the best clear liners, again, feels low-hanging fruit. So thank you so much for coming on and making sure our teeth stay really healthy.
Thank you for having me.
Yeah, I love you.
Love you.